A very good evening to all the respected senior faculty members and medical colleagues. I'm Dr. Sahil Singla, consultant urologist at Pushpanjali Medical Centre. I'm here to share a case, very rare case of a disorder of sexual development. It is a rare because less than 200 cases has been reported in the literature worldwide till now. A 28-year-old unmarried male presented to my OPD with a chief complaint of bilateral undescended testes since birth. And on examination, it was found that the testes were not palpable either in the scrotal sac or in the inguinal region, but the male secondary sexual characters were well developed and the erectile function was normal. I get that patient for diagnostic lab, and intraoperatively I found that there were bilateral testes were there in the pelvis, but along with them there was a uterus and the fallopian tubes were also there. You can see. And both the testes were attached to those tissue. So I just performed hysterectomy with bilateral salpingectomy and bilateral testicular biopsy was taken to rule out any malignancy if there is present. And I performed the bilateral orchidopexy. But that person is getting married in the next 3 months. So the histopathological report revealed that there were seminiferous tubules lined by immature Sertoli cells and primitive germ cells without any spermatogonia, but no malignant cell was seen. And the uterus, there were endometrium was in proliferative phase, but myometrium and fallopian tube were unremarkable changes there, but no ovarian tissue was there. And serum testosterone level was in normal range, but LH and FSH were raised, suggestive of primary testicular failure. So two differentials were there. Either it could be a primary this persistent Mullerian duct syndrome, or it could be a over-testicular dysgenesis syndrome. To rule out these things, there was just one option to do a chromosomal study, and it revealed a normal 46XY syndrome. So it was a persistent Mullerian duct syndrome, because in mixed gonadal dysgenesis syndrome, there was a mosaic pattern. There is 45XO on 46XY's chromosomal pattern. So this PMDS is basically caused due to these Sertoli cells misfunctions. They do not secrete the Mullerian inhibiting substance at 8 weeks of gestation. So the structures of Mullerian duct they developed, which includes the uterus and the upper part of vagina and the fallopian tubes, which get developed in this patient. This is a rare case because even less than 200 cases have been reported in literature. Literally, literature, there is no almost 150 or 160 cases are there. That was latest literature. So just sharing this case because in case of bilateral cryptokidism, this PMDS should be kept in mind. So just sir, in case of cryptokidism, if the bilateral testes are not palpable, the best thing is to do a diagnostic lab rather than do MRI. So I just directly go for a diagnostic lab, and intraop I just got to find. This was a surprise. This was a rare case, sir. I am doing orchidopexy from last 10 years, but I have never seen such a case. In PMDS, there are two types of syndrome: PMDS type 1 or type 2. Type 1 is male pattern. In that case, these Mullerian duct structures are mobile. So one of the testes get into the scrotum, but other one is attached to this structure. So usually patient present with a unilateral cryptokidism. That is a most common type, and 80 to 90% patient of these 200 cases, literally say, they present with that. And this was a second type, female type, that is reportedly 10 to 15%. And the bilateral testes were attached because these Mullerian duct structures were immobile, so they were both present in the abdomen.
This patient had clinical hypogonadism in terms of the secondary sexual character?
No, sir. His secondary sexual characters were well developed. His erection was normal. He was getting married after 3 months. So he just come to my OPD कि सर बच्चा होगा या नहीं होगा, मेरे को इसीलिए आना पड़ा. No, sir. I was just surprised. I just told him that if there will be tests, I have to remove them because after puberty there are chances of malignancy. So I have just taken consent for orchiectomy, but he said I am getting married in next 3 months, so I do just to do, you just take biopsy and do a orchidopexy, and I will see later on. And he is doing fine from last 1 year, and his wife also knows about this thing that they have to get this ICSI or everything. This is I have already submitted to BMJ case reports, British Medical Journals. Thanks.